Hello, it's Dr. Adesina from ftplectures.com. Today I want to talk to you about the benefits of exercise. Our job as physicians is to promote health and prevention. And today I just want to implore you to start, if you haven't done this, to start incorporating exercise into your lifestyle. A lot of people actually think this is difficult, but it's actually very, very easy. Exercise starts with a state of mind. First, you want to set a goal, okay? Either if you wanted to lose weight, you can say, I'm going to lose 2 pounds in the next 2 weeks. Okay, that's a reasonable goal, okay? Start with reasonable goals that you can achieve and start with baby steps. If you have a gym that's closer to your house that you can drive to or not too far from your job, you can make an effort. Say, okay, when I leave work today, I'm going to spend 20 minutes or 15 minutes at the gym. Don't try to overexert yourself when you're starting, okay? Start small. It's all about baby steps, okay? So if you decide to start going to the gym and say, okay, I'm going to go to the gym and work out for 10 minutes. It might not sound like a lot, but it's better than a sedentary lifestyle. Okay, and then as you start to build up your endurance, when you go to the gym, first talk to the experts. Okay, they have people that work at the gym that will be able to show you some of the exercises you can start. Okay, you can start with like simple weightlifting exercises, endurance exercises like simple walks or jogs, okay, or even simple runs, something simple. Okay, don't start too heavy. And number 2, don't compare yourself to other people. Okay, work at your own pace. Okay. Everybody is different. Your body is different from my body. When you go to the gym to exercise, do what your body can actually maintain and actually you can endure. So you're not overexerting yourself and not causing muscle damage. A lot of people will go to the gym and the first thing they want to do is probably, if it's a guy, they want to go grab a 40 or 50 pound weight and they haven't been to the gym in a long time, okay? Why don't you start with 10 pounds, okay? It might look small, but you're still exerting yourself to at least your limit. Also, always ask for help, okay? Always make sure you read instructions of the equipment so that you don't injure yourself in the process of starting exercise. Also, drink a lot of water. When you go to the gym, always bring at least a liter of water because you get very dehydrated and you're sweating a lot when you go to the gym, so that as you're working out, you're replenishing back those fluids, okay? Also, if you can afford to buy Gatorade, for example, you can take half of a Gatorade, okay? Cut it into half because it still has a lot of sugars in it and mix it with half of water. Now, this is going to be diluted because now you have some electrolytes to replace some of the salts, the sodium and potassium, and also the chloride that you lose, mostly sodium and chloride, from your skin when you sweat. So it's very important you drink some fluids and electrolytes as you are working out at the gym. Now remember, start with baby goals, okay? If you're gonna start, say I'm gonna start 1 day a week, okay? That's not too hard actually. If you start 1 day a week and you're being persistent for another 4 weeks and you notice, I've been going to the gym once a week and I'm working out, okay? Even if it's only 20 minutes at the gym, at least you're doing something. And then increase it to like twice a week and 3 times a week. And eventually get up to 5 times a week, okay? A lot of people try to go for big goals and try to do too much while not realizing it's all about baby steps, okay? Now, once you get into that habit, always remember to do cardio exercises, okay? Do a bit of running to get your heart rate up, to get your blood vessels dilated also, to get more refreshment, okay? It gives you better memory. It gives you more endurance, it gives you more strength. It also overall helps your body health, okay? Exercise has been shown to decrease the risk of developing diabetes, high blood pressure, okay, and cholesterol. So these are all the top 3 common diseases that is found in the world today that a lot of people are suffering from. And if they just start with exercise, you can prevent yourself from being started on a medication for high blood pressure or even a medication for diabetes. Believe it or not, 25% of patients that have diabetes, at least type 2 diabetes, can be saved by not taking any medication. 25% if they just do diet and exercise. Okay, now talk about diet. If you're gonna start yourself on a diet, okay, you want to reduce the amount of carbs. Carbohydrates tend to convert into fat later on when you eat too much of it. cut out the sodas out of your food, okay? Sodas have about 160 calories of energy in them. When you drink 3 or 4 or 5 or 6 cans of soda a day, that is a lot of sugar intake. There's only a limit to how much calories, kilocalories our body actually need daily. Also cut out salt, okay? Too much salt in your diet can lead to high blood pressure. Okay, a lot of African American can predisposed to having actually retaining more salt content than other races. So it's important that whatever race you are in, make sure you cut out your salt diet. A lot of people eat a lot of salt and they don't even realize it. There's salt in canned foods. There's salt in even beverages. There's salt on pizza. There's pretty much salt on every, French fries. So you don't realize how much salt content you're consuming over the course of a day. So if you cook at home, okay, make sure you also reduce the amount of salt you're using to cook. Over time, your taste buds will actually adjust to the salt level that you are as you go down. And you'll be amazed. The first time you'll be like, oh, wow, there's no salt in this food. It's because you're so used to a higher concentration of salt content. That's why you're feeling that way. But over time, you kind of win that off also. Okay, so remember, when you're gonna start with a diet, start with the basic stuff. Okay, cut out so fatty foods are also contributing to worse health. Okay, remember, there's only so much we can do as medical doctors to cure ailments. If you actually prevent diseases from happening, you have more likely chance to live longer because you don't have to deal with the consequences that the disease brings along with them. Okay? So these are my small tips for today to learn about exercise and diet. Okay? Thank you very much. It's Dr. Adesina from ftplectures.com. Have a great day. Bye-bye.